Welcome to Soft Bites Podcast. Your life, your dentistry. We talk about ways to have more fun and meaning in one of the coolest and most rewarding professions in medicine. Conversations on how to bring awareness, create a healthy workplace, and provide emotional insights to make dentistry a fulfilling activity while making space for one's wonder, creativity, and freedom. Here are your hosts, Manuela and George Andre.
Hello, everyone. Welcome to another Soft Bites podcast. Hello, Andre. How are you?
Hello, Manuel. I'm fine. How are you? This is one of the very few times that we record in the morning, not in the evening.
True.
It's a holiday in Portugal.
I think all over Europe, actually, right?
Yeah.
Here it's it's the first of it's the 1st of May. I think it's all over Europe. And how are you? Everything's well?
I'm fine. How are you?
I'm
doing
good.
Great.
I'm good also. Thank you. Okay, so let's talk about something that we already mentioned in another episodes, and we decided that it was worth to do a whole episode just about this, which is the onboarding of new team members. And when we talk about onboarding of new team members in a dental clinic, we have to talk about not only dentists, but dental nurses and other staff. For example, there are dental nurses that do only the reception, dental nurses that work only in cabinet. There are nowadays also dental clinics have managers. So I think it's interesting if we distinguish all of this, and that we talk also about the importance of a good onboarding process in a dental clinic and the difference that it can make, and how you can, how this onboarding process can happen. Because I know that you do it on your own practice, and that one of the things that you have on your clinic protocols is about the onboarding process. And I think, I don't know about your experience, but do you think that an onboarding process is something that it's usually done in a dental clinic?
So I think that the onboarding process, and it's very good that we are recording the podcast specifically on this. I think it's not only important, I think it's critical. It's really critical. It's one of the biggest distinguishes of healthy environment, and I would say overall a happy employees and happy team in your practice. And it is also one of the most common mistakes. I think it is
because
really,
it's not
really
done right.
Yes. I from the experience that I have, I mean, I have a lot of feedbacks from students, or from especially from Portugal, but not only from Portugal, and I really think this is unfortunately still something that is rarely done in dental practices, and it is one of the most important, one of the most differentiating factors. And I think that today it gets even more important because, I mean, the demand of workers, of staff. I mean, anyone that you employ today, their expectations are gonna be higher than they were 5 and 10 years ago. Because I mean, people today demand that other people are up to the standards that they expect, and I think that to have a sound strategy for onboarding, I think it's really, really important. I think you can't afford not to have one in your practice. Either you have one, either you are going to hire the first member of the staff or the 10th member of the staff, whether it's assistants, whether it's managers, whether it's receptionists or clinical assistants, doctors, hygienists, you name it. You really need to have an onboarding process for this. I need to spend time to think about this.
And I already mentioned this. There's a website which is called Glassdoor, and it's a career community. So it's actually started in America, but you have it available in many countries nowadays. And it's a website where workers evaluate in an anonymous way the companies where they work. or where they worked. So, and they do studies, and according to Glassdoor, organizations with a strong onboarding process improve new hire retention by 82%, and they raise productivity by over 70%. So I think so. This shows the importance of a good onboarding process. So let's start by saying that, for the ones listening, onboarding refers to the process of providing new employees with the resources that they need to transition into their new role with the company. And I think that in the dental clinic, we can start by distinguish, because I think an onboarding process is different, for example, for a dentist or a hygienist, or for a dental nurse. And sometimes I think that because the dentist or the hygienist does not need the technical onboarding, right? Because they already have the technical skills. Sometimes the owners of the clinic think that they don't need an onboarding, but that's important too, right?
Yes.
Mm-hmm.
Yeah.
What is your experience?
I'm going to start by hitting some points which I really think that are overall important. So number one, you need to think about this as a practice manager, as a practice owner. You need to think about the onboarding process, and the onboarding process means that if you are thinking about onboarding, it's onboarding into systems that you have. So you cannot have onboarding if you don't have written systems. They don't need to be complex. You don't need to have like a 200-page manual like I have in my practice that was done throughout like 10 or 15 years. But you need to start somewhere. You need to start writing things down. I mean, processes, how you answer the phone, how the patient is taken into the cabinet, what are the checklists to do every week, what are the checklists to do every month. I mean, there's an infinite amount of checklists that you need to do. And you don't need to despair if you haven't started yet. Just do it slowly. But so an onboarding implies that you need to have a system in place. Okay, so the onboarding is how do you present your new staff to that system. So by default, you need to have that system. And again, don't panic. If you only have one page, if you only have 2 pages, it's a start. Okay, so that's number one. So, and number two, I think that the statistics that you gave of staff retention, they also mean that that the company that is hiring is showing them respect and is showing them some care and is showing them some preoccupation regarding their introduction to the company. So this is a sign of respect. This is a sign of ponderation. This is a sign that you are actually taking your time to make the person feel comfortable getting inside your company. Okay, and this is really important because you are showing that you respect people. You are showing that they are going to go into an uncomfortable situation, because it's always uncomfortable in the beginning, and you are showing that you care, and this is really, really important. So basically, you are giving them a sign that you are in tune with their uncomfort, okay? So, with that discomfort. So, let's say that, let me give you an example. One of the first things that I say to anyone that comes into my practice, staff, now we are talking in generic terms, nurses, managers, doctors, or hygienists, the first thing that I tell them is this: look, don't feel anxious. We know this is going to take time. We are going to be patient with you. You are going to make mistakes, and we are here to make that transition as smooth as possible, okay? So our goal is not that you are perfect in the first day or first weeks or first months. We know this is going to take time, especially if for example, if it is a nurse that she has no experience whatsoever in dentistry. They may even have experience in some other medical fields, but dentistry is completely different. And if you are going to place them inside the cabinet, it's going to be a little bit difficult. And so the first thing is that we try to make them understand that we are going to be patient with them. Okay, that this is that our systems may be a little bit different than what they are used in the past. Even with doctors, the same thing, and we are going to be patient with them. Okay, and number 3, we tell them, look, the first 3 months, the main thing is that you observe what's going to happen. We are not going to demand from you to be perfect, and we want you to observe. You don't have to be productive in the beginning, okay? We just want you to observe. So, for example, if a doctor comes to my practice, the first 3 months, it doesn't mean that they will not see some patients here and there, but usually for a doctor, at least 1 month, they will need to see us work, okay? They will need to see us work. And of course, for doctors, there are clinical situations and non-clinical situations. The clinical situations, even though there's protocols and there's the evidence and there's the state of the art, we believe that we want to make our protocols more or less standardized between all the doctors, and we have all those things written down. So they can always, during those 3 months, while they are observing us, simultaneously, they are reading the manual, okay? And again, yes, don't be scared, but you should write a manual, even for clinical stuff. I mean, how do you do a contact point? What are the critical points in terms of the contact point? And this is not something strict. I mean, this new person can suggest us some better ways of doing the contact point. There's nothing wrong with it. That's the clinical stuff. And then more importantly, there's the non-clinical stuff. And we talk a lot about that here. Usually we have a code of conduct for nurses and the code of conduct for dentists. I mean, for example, let me give you an example. You should not bring your cell phone into the cabinet unless it's something that is really important, that you are going to check something to talk to the patient or something. But usually you don't bring your cell phone to the cabinet. Also, while you are in the cabinet, you should have a professional posture. You should not be standing against the walls and stuff like that. I mean, there's a whole lot of behavioral rules, let's say it, that people should attend when they come to work with us, and there's nothing wrong with that. I mean, these are flexible, these are common sense, but it's important that they are written. Okay, so there's clinical stuff and there's non-clinical stuff. So during these 3 months, so there's the component of reducing their anxiety, making sure that we are understanding that it's going to be uncomfortable for them and that we are going to be patient. They observe us, and they ask questions, and also they read the manual. So there's usually these 4 components. And if you have these 4 components, I am absolutely sure that the onboarding process will be much more productive. So this is for dentists. For nurses, it's pretty much the same thing. And in nurses, I think that what happens is that there's a lot of nurses in many countries. I would say most of the countries, nurses, they don't have a specialized education regarding dentistry. But even if they have a specialized education, there's also the non-clinical stuff. And every office has their own systems, has their own rules and protocols. So it is very important that you don't do what I call to be the reactive communication. What is the reactive communication? So let's see 2 examples, 2 different practices. One practice that has these 4 components of the onboarding, another practice that does not have these 4 components of the onboarding. And again, these are reduce their anxiety, show respect, let them see you work, and then also make sure that you have something that is written and that they can follow through. So you have these components, and the patient comes in. The new staff comes in, and you see that the transition is comfortable for them. This is one situation. The other situation is what I call reactive communication. So the staff comes in, and it's just like, okay, so you completely delegate in a non-organized way the learning of this new nurse by the older ones, okay? And there's nothing wrong with that if that is organized. If that is not organized, you are asking an older nurse that is, of course, stressed, that she's most of the times already busy with her own work, and on top of that, on top of that, you are providing her with an additional source of stress, which she's trying to teach someone by trial and error. So there's going to be a lot of trial and error in this reactive communication. So basically what is happening is that you did not take the time to proactively communicate the situation by those components that we talked about. And now what you are doing here is that you are letting her observe and do mistakes and be anxious and feel uncomfortable. And now on top of that, because you have not organized your team, you're going to reactively communicate with her. And this is going to be a lot of a source of stress and drama. And in my opinion, one of the biggest sources also of low retention rates of new staff. So it's very important that you distinguish these two different styles. And you may say, well, that does not happen in my practice. But trust me, even in my practice where we try to organize things as much as possible, it does happen. So there's always going to be a period of anxiety and trial and error. But as long as the person feels safe during that process, as long as the person is assured that this is normal, she's going to do mistakes or he's going to do mistakes, and we are here to help and correct and to dynamically interact between us, I think you will be safe. Otherwise, there will be a lot of stress, a lot of drama and everything that that happens in dental practices.
Yeah, and because there's a lot of stress and a lot of drama, that's one of the reasons why the onboarding process sometimes it's not done, because there's no time, and there's so much going on that sometimes you even think, like you are saying, you even think that you are doing it, but you are not actually doing it, because it needs time and it needs to be very, very intentional. And the work that you are used to do cannot be the same. Your day work cannot be the same if you have a new person with you on the first week. So you have to take that in consideration. It has to be different. If you are doing your normal work day with a new person there, it's because something is failing on the onboarding process. So it's very interesting what you said. So and again, for dentists, because sometimes dentists already and the hygienists also already have the technical skills training, you think that that you don't need any onboarding. And I know about cases that their first day of work, they don't even know what's inside the drawers. They are opening the drawers for the first time. So, but what you said is very important. So it's not only, so the onboarding also has to include best practices. It also has to include the company culture, education, and those things can and should be also written in the protocol, because it's because they seem like simple things, but it's not so simple things. Those details that you said, the fact that you should not enter a cabinet and only if you have a valid reason to do so. And if you do so, you should always say, excuse me, and you should always announce yourself. So those things, they make all the difference, because those things are the things that make the company culture.
And even that thing that we discussed in the previous podcast, which is create the habits of saying thank you and I'm sorry. Simple things.
Yeah. So I think it's very important that we are saying this, because sometimes this is things that you think they are common sense, but then they are not, and you lose them, and it makes all the difference in a workday. Okay, so let's say that you have that onboarding process of 3 months. Do you think that those 3 months are also for dentists and hygienists, or the onboarding process is faster for dentists and hygienists, because you don't need the technical skills training like you need for assistants or receptionists?
I would say that on generic terms, clinical staff that has specific education for that, they usually take less time. So at least for doctors, I have them come at least 30 days to observe us, for doctors or hygienists, to observe us for 30 days before they start to do the clinical work. This is what we
So 1 month.
Okay? So 1 month, that's for doctors, okay? For nurses, I would say they are on a more passive role for about 3 months, okay? But I think that, I think those two numbers, 1 month and 3 months for nurses, I think they are okay. However, I think that you should be flexible on this. I think the most important thing of all, and I really think this is, so let's say you don't have a manual. Let's say you are opening a practice, there's chaos, there's construction. I'm going to actually talk about my experience on that. I think the most important thing is to say, look, I know we don't have a manual. You may feel a little bit lost here, but look, we understand you, and we have your back here, okay? This is, I think, the number one thing for them to understand that you are empathetic with their anxiety, you are empathetic with their discomfort, and you have their back. So they are going to do mistakes. Just relax. We are here. We have your back. What you have to do most of the times is observe, and in those 3 months they can do the most like straightforward tasks. So please pick me this and please pick me that, and stay here and observe. Right. So it's very comfortable for them. And if you explain that to them, look, we are going to give you some small tasks, but your main goal is to read the manual during these 3 months. Also, find some things that you think that are not working well, because this is really important. New staff is very important to revise the systems, because they are going to bring a fresh look into the systems, right? So this is one of the biggest opportunity to improve your systems, because you're going to have fresh eyes of someone that comes out of your practice to look at the system and say, look, this doesn't make sense. There's a lot of steps here. There's 10 steps for this process where we can actually reduce them in 2 steps. And this is really important, because sometimes you get completely blind here. So again, I think that the emotional aspect is really important, to show them and to communicate this actively, that you are showing them that you respect their anxiety, that you are expecting them to do mistakes. And this is really important. I think this is more important than the time frame. And of course, there's limits for everything. If you believe that there's someone that during that period of time is really not doing any progress, and again, I think we should be very, very tolerant with people that are just anxious, or that they don't have that much of the communication capacities. And I think that the number one factor of all, in my opinion, is the willing to learn and to evolve. And this is something that I think it's not talked about. We look a lot of technical skills. I mean, we want a good looking nurse, right? We want someone that is younger. We want someone that knows how to speak. We want someone that is charismatic. But I think that the most important factor is the willingness. They may be doing mistakes, but you see there's a willingness to progress and to evolve. And I think that character is something that is very difficult to evaluate. But for me, personally, I prefer 10 times a nurse that takes 1 year to do things right, but is willing to learn, and you see that person is really making an effort to improve, although they have limited capacities. That someone that has a huge charisma, huge communication skills, but you see that the progress and the willingness to learn and the willingness to sacrifice for the team and etc., that is not there. And I think that you can talk to and you can read many management books about this, and I think that all leaders will eventually tell you that character is the number one factor in terms of team. The capacity to be willing to sacrifice for the team, to sacrifice your own ego for the team, that's number one. It's very difficult to access that. But this is just a reminder so you may eventually find a superstar in the first week. I mean, this girl, she's a superstar. This guy is a superstar. I would really be careful with those early assumptions, because usually a high talent is most of the times not followed by a high character, because these are people that are used to being to being successful. They are used to people liking them, and sometimes the effort is not there. There's a lot of, if you have a person that is naturally talented, and this is my point of view, and she's used to people liking them because of their looks, because of their communication skills, I think that this is usually someone that does not have that much need to work harder, okay? And I recently said something that teams are not made by people with amazing skills. Good teams, they are made by people with character. And character cannot be bought. Character can only be acquired through suffering. And this is a harsh reality. I mean, people that have to deal with drawbacks, with limitations in their looks, limitations in their communication skills, those are usually the people that are the best teammates. And I think this is something that we usually forget. So there's usually this correlation, whether you like it or not. People that have more struggles in their lives, they are usually better teammates because they understand that their character has been molded through struggle. And this is just a reminder that time is important, but first important, don't be eluded by first impressions. Okay, I always prefer to have someone that we can mold to the practice. But what I mean by molding is that I mean not in a negative way. So basically, we try to show our values in the manual, try to talk about that in regular meetings, etc. And we try to convince people that these are good work, these are overall good values to be present in the team, and we are open to change, etc. And I think that at the end of the day, if you bring positivity to the culture, if you bring care to the culture, if you bring respect to the culture, if you bring evolution to the culture of your team, I mean, we want the staff to evolve. I think at the end of the day, they will appreciate your efforts and they will stay there. And yes, that's it. That's this. I think this really all the things that in terms of time are important, but I think it's not the most critical part. Time is important, but not the most critical part.
I have two questions for you, though, that are the same, that are related with the same thing. So, is onboarding the same as training?
I would say that training is a continuous. It's something that
it's
is
part of the onboarding.
Yes. It is part of the onboarding, but I would say you should have continuous training. And for that, this is why it's important to have the written manual and the frequent meetings with the staff and with the team. This is really important. Okay. And today with Zoom, there's no reason why you should not do meetings, shorter meetings, like half an hour meetings every month or 1 hour meetings every 3 months. And just stick with the schedule. Don't book a half an hour meeting and stay for 1 hour talking. This is not a sign of good leadership, really. Mm-hmm. But I think that training is a continuous process. This is the way that I see it. And onboarding is that initially, I mean, you're going to throw people into the lions, right? Into the lion's cage. And you really have to be careful there. And this is what I call onboarding. The training for me is an ongoing process. But yes, I mean, it's just a semantic way of
because
of
I think that
things.
Sometimes in dental clinics, I think dentists who are dental clinics owner confuse these two things. And I think that when you the onboarding with the training, because they think that for example, the onboarding of a dental assistant is to give them the training, and I think it was
I understand.
very important what you said in the beginning about the onboarding being also the introduction of the company culture, the company values,
making them feel safe.
Yeah,
making them feel safe.
So that training can be and should be, and it is a part of the onboarding, but it's not the only thing. So you should not confuse this two. And of course, training will be present always
throughout
the career. But
yes,
but But it's not the onboarding. So onboarding is much more than that. And that's, I think that's something that we should make very clear, because when we talked about those numbers before, and of course, we know that one of the problems sometimes in dental clinics is that clinics cannot retain their staff, and there's a lot of rotation in staff, and that's not good. So, and those numbers that we talked about before, so that a good onboarding process improve new hire retention by 82%. We should make very clear that don't confuse the onboarding only with training. Of course, training is important and it's part of the onboarding, and it will continue, but a good onboarding process is much more just than training. And also the second, continue. Then I make my second.
One of the things that I'm going to give you an example. There was, and I think I talked a lot about this in the podcast. About 2 years ago, I was going through a difficult process because there was staff that was leaving. I had another staff that she was pregnant and she was not working, and I had to hire 2 new dental nurses. While I was in a period of constructions in my practice, we were expanding. I mean, it was chaos. I mean, there was no protocol. I mean, the protocols were not working because everything was logistically different there. And how can we manage that? The only way that you can really manage that is to explain the new nurses, look, this is what's going to happen. I understand it's not going to be easy for you. We have the written manual, but this is exactly what is going to happen. We are expanding for 2 more dental units. It's happening this and this and this. So this is the point of the situation. We understand it's going to be uncomfortable for you. We understand that everything is different. We understand that you are going to be working with someone that is in a completely different generation from you. Some other people have left. Some other people are at home. So just be patient here. We have your back. I want this to work out fine. Just be patient. This is going to take a little bit more time, and understand this can be a little bit more chaotic. But also, it's also important, please let me know and write down things that you think that should be improved. Okay? So if you have this continuous talk with, so this is why it's important what you said, which is onboarding is not training. Onboarding, there's a lot of the emotional component. So make the patient feel stable there. Make the patient feel comfortable there. Make the patient feel confident there. Okay, so this is really, really important. And also ask for the feedback.
The second thing that I wanted to talk to you regarding also this onboarding is not the same as training, is the importance, because we said in the beginning that the onboarding for dentists is different than from dental nurses, because sometimes dental nurses don't have the technical skills, so the onboarding takes more time. But I think that we should also make the distinction that for dentists,
absolutely,
the onboarding is also different and should be more take more time and be more with more care with young dentists, because young dentists do need the technical skills training. Yes. And sometimes, and I think that you also already witnessed this, sometimes we have colleagues, dental owners, clinics, complaining about young dentists and that they employ young dentists and that they are not up to it. Yeah. But maybe that's one of the reasons. Yeah, one of the reasons is because the onboarding process of a young dentist should be different. Training should make part of it.
Of course. Yeah.
And this, you can even add to this training a little bit of mentorship, because but you need time for this. Yeah. So I think this is very important to take in account when you hire new staff, and we already talk about this in an episode, that the hiring of the staff should take in consideration where your practice is and what you have, what you can have in time. Because if you don't have time to do a training of a young dentist and to be a little bit of a mentor to that young person, then you should not hire a young person. Then you should hire someone already with experience, because then the onboard process then is like that 1 month that you were talking about. For a young dentist, an onboarding process of 1 month probably is not enough, right? Because you need to train this person. What do you think about this?
I think that you just hit an important issue there. First of all, I prefer young dentists to work in my practice. I always prefer that. And I want to explain you why. I think that we had an episode about should we hire something with more experience, someone with more experience, or someone that is new. But I always prefer someone that is new, and I'm going to explain why. The reason why I prefer someone that is new and has no experience is because we can coach them, and we can coach them not only technically but also the character stuff. And we do work a lot by example. Okay. So
it's a little bit of the mentorship that I was telling, right? So it's very important that you have that mentor, that coaching.
Yes. Because culture for me is everything, right? Culture for me, if you have a right culture, and if people, they respect you because you treat them well, right? If people, we think we talked about this in the past, the best way to influence someone is to let them influence you. So if you listen to other people, if you understand their issues, and if you try to help them, they will help you, right? But you need time for that. And this is why a young dentist is much better in my point of view, much better for my practice than an experienced dentist, unless I know that person and I understand that their culture and their character is aligned with the culture of the practice. I cannot expect a 40-year-old person or a 50-year-old person to have the flexibility to change their values and their personality and their character at that point in time. It's not impossible, but it's going to be more difficult. It's very rare that you find someone that is willing to change in their 40s and in their 50s. There's a lot of bias and misconceptions. There's a lot of dogmas, fundamentalism. I mean, very few people in their 40s or their 50s are willing to question things that they do in life. And we are going to have a podcast about this soon, right? It's very rare. We all do that. And this is why I prefer young dentists. And I think that mentorship is really important because, for example, I want them to understand why, for example, we give guarantees of treatments that we do, even though in dentistry and in medicine there's no guarantees. I want them to understand why we call the patient the next day. I want them to understand why I actively and throughout the day 1 million times I say thank you to my nurse. Because many people, they don't understand it. Why are you always thanking your nurse? Why does every time that she give you something that is part of her job, you say thank you? That's stupid. And for many people, that's just a stupid thing, right? And I want them to understand, and I want them to feel, and I want them to actually feel in a team why that is so important and why that is so easy. And if you make it the default, it changes many things. And this cannot be said in the initial interview. They have to see this work. They have to feel this work. They have to actively feel how this changes their own character by seeing someone doing that. And I think that mentorship, honestly, I think it's really easy. The problem is that most people, they don't have the time to be mentored. But anyone that wants to come to my practice, that wants to see me work, I always say yes. Always. If they want to see me for 1 year working, they can come and see me working for 1 year. Do they have the time for that? No. Very few people that I know in my life, dentists, have had the time to do it. And they are very good dentists. They are not because of me, but because of them, because they realized that they wanted to see other people work. So they took time off to see other people work. They on purposely were losing money to see the other people work. And that is a mentality that I think that it's not very present, right? So that's one thing. I prefer younger people. And also, another thing is that dental schools today are not the same thing that they were 10 or 20 years ago. Why? Because the curriculums are shorter, the number of patients are shorter. They are doing more and more simple dentistry. They want to do today what they call safe dentists, and every that is more complex, wisdom tooth removal, some surgical extraction. Now it's going to postgraduate education, right? So it's very normal that you have people that don't have that much experience, that the amount of clinical experience that they have during the pre-grad school, it's not very significant. So it is obvious that you have to mentor them. But look, you just have to let them see you work. That's it. It can take 1 year, it can take 3 months, whatever, but just let them see you work within some certain rules. I mean, for example, I always tell them, look, you enter the cabinet when I ask you to enter, because I want to be alone with the patient, with the nurse and with the patient. I want to ask the patient, look, there's someone here doing an internship. Can they come in and see you work? Do you mind with that? And they say, oh, it's fine. Now the nurse comes and calls the doctor. It's not like all of a sudden the patient enters and I am there standing with someone that they don't know all of a sudden. No, they have to be introduced on that. And for some patients, I tell the new doctor, look, this is not an easy patient, so it's better for you not to be present. And it's fine, right? That they can go and watch someone else, and they can see how people interact in the practice. I mean, my practice, sometimes when I talk, it seems like my practice, it's perfect. It is not perfect by no means, but I think that's not the point. The point is, there needs to be a culture where you feel that people care for each other. But are also transparent and direct when something does not go right. Okay, so I think that being exposed to that culture is really important. Okay, so yes, you cannot expect that today's doctors, young dentists, they have the clinical skills that you had when you get out of grad school, because 20 years ago you did like 20 extractions. Today they do like 1 extraction. So of course they are not. They are not up to it in the first place. And number 2 is because that families today are not the same thing that they were 10 years ago. I mean, there's social media, they spend their times on the phone. Of course, there's social skills. You cannot expect them to have developed social skills because they were not taught to. So you have to show them why that is important. You have to show them from A to B why that is important. And I think that we've talked about this before. I think this newer generation, they understand that what their parents were doing was not working. The rate of divorces, the amount of unhappiness and depression and mental health, I think they are more aware today that things need to change slightly, because otherwise they're just going to do the same mistakes and they're going to have the same results in terms of emotional health, of mental health, of relationship issues. I think that today they are more into this stuff. They understand that culture really is important, and they think, actually, my parents and my uncles, I don't want to do the same things that they did. I don't want to have to do the same mistakes that they did. So there must be something different. And we talked about that. For example, in Tinder, they realized that this generation, by the first time, they are really changing the rules that happened until now. So looks, it's not the first thing that predicts the second date. It's not the first thing, the looks, but it's actually the way that they can, if the other person lets them be themselves, makes them, allows them to be themselves and to feel safe. I think this is, if I'm not mistaken, this is number 1 factor for them to go on a second date. So yes, we are dealing with a newer generation that we have a lot of new challenges. But I think that in certain ways, they are much better than us. In certain ways, they are much better. In other ways, of course, in terms of education, sometimes in social skills, the way that you talk to the patient, I mean, you cannot expect that they are experts because they have never been told to. I mean, the social interaction that they have is not that much in presence. It's much more through a cell phone. So, but if you show them how important that is for their own good, I think you'll be fine. If you have patience with them, I think they will be fine. And for me, I always prefer this route than the route of hiring someone that is experienced. In my practice, This is my practice.
Mm-hmm. Yeah, Yeah, and we talked about that on the other episode of like, should you go for an experienced dentist or a new, less experienced one? But I think it's very. I think in the case of young dentists nowadays, it makes all the difference. If you have a good match with the person that employs you, and that person has indeed the time and the mindset of coaching you and of giving you mentorship, not only on the technical part but also on the social.
Can I just add something that I learned over the last 2 years?
Yes,
I think that individuality is really important to keep. You know, I mean, I have staff that is just
you should have the freedom to be yourself on your work.
Yeah, I have staff that they just don't like people, you know. Oh, people, too much people. I don't like too much people, you know. I have other staff that love people, you know. And I think that you should ask from the staff that doesn't like people to do the best that they can, even though you know that their empathy is never going to be on top of the game, right? And you cannot force them, right? Yes, you need to do some adaptations. Yes, they need to understand that they need to treat other people well, and there are some minimum standards, of course, but you cannot expect them to excel in human interaction, right? And I think you have to respect that within the boundaries. For example, one of the issues that I had, that I still have in my practice at this point in time, is that with the new staff that I brought, they are very expansive in terms of communication. They laugh between them. They are always joking between them, and there is nothing wrong with that. And I told, there's nothing wrong with that, but be aware that you are in a health providing company. And there's nothing wrong with that as long as the patient on the waiting room does not hear you laughing and parting between the two of us. So yes, you can do whatever you want, but you do it with the doors closed, and you do it when there's no one in the practice. Otherwise, there's nothing wrong with doing that. But remember that there always needs to be a balance here. But you cannot demand standardization in terms of human behavior of everyone. I think you need to assume some individuality there and to be tolerant with that.
And that's a very interesting conversation. And when we talk about protocols, and we defend, of course, protocols a lot, and that a clinic should have a system and that should be based on protocols, all of that. But it's very there's a very thin line then for you with those protocols and system to uniform everyone and to have like this dictatorship that you have to behave this way, but that cannot happen, right? Like you said, otherwise you lose individuality and freedom, and people.
There need to be standards, right?
So that's it. So protocols are guidelines. That's it.
Patient comes in, you should welcome them, right? And I mean, there are guidelines, there are standards, right? But you have to understand that each individual is a different individual, and if you fight that, it will be counterproductive. If you actively fight that, if you don't, it's much better to spend the time. Look, I know you are like this, but look, the consequence of your behavior might be this. So I'm not asking you to force. I'm just asking you, just think about that, and sometimes it's better not to force the person, but to tell, look, your behavior can cause this. What do you think? I think this is a better way of dealing with individual personalities.
Just before we finish, let me talk about we have the onboarding, and then we have also the offboarding. So that's and this is something that it's really not talked about. But the same way that you have an onboarding, you should have an offboarding protocol, because sometimes when there is the departure of an employee or of someone that makes part of the team, that can really have a negative impact on the team. So, and I think that if you have also an offboarding process, it makes that negative impact a little bit softer if you are prepared for when someone leaves to know what to do, so that there is no loss of knowledge, or there is no loss of productivity, or even of data protection. This, I think this is in a dental clinic, for example, with dentists, very important that you have this from the beginning, that when we should even make part of the onboarding process, you explain what happens when that person goes away. So I think this is very important also, so that you be prepared when you have someone leaving your team, that you have also an offboarding process.
Yeah, I don't have an offboarding process. My thing would be always let people go in good terms, because you win nothing with revenge or any negative emotions regarding. Because sometimes offboarding can mean like it can happen because of a negative situation, right? From both parts. It can be that person that's has found a better job, or it can be that you are not happy with them. I think that no matter what, you should tackle these issues with as much fair play as possible. And but at the end of the day, I think that should tell, look, yes, we are going separate ways, but look, I appreciate your journey with us. You may open the doors for the future. Say, look, whenever you want to come for the future, please let me know. Anything that you may need, just please let me know. If it's in good terms, if it's not in good terms, even still, you should have fair play here, because you win nothing by creating enemies or creating anxiety or drama. So whatever happens, I think that trying to make sure that you live in good terms is important, because in the future, that person might come back, and you win nothing by creating resentment, because basically resentment, you bring home resentment, and it just destroys you, and it makes no sense. And there will be people that will leave your practice for sometimes because they're going to win more. Sometimes they're going to have better conditions, or sometimes they just want to work in another field, and it's fine. And I always tell my dental nurses, if you want to change for something that you feel it's better for you, I'll be the first one supporting you. And if you have, especially if you have a career, if you have some other education that is not in dentistry, I would be more than happy if you fulfill your dreams. This is my goal, and I hope that your journey here has helped you, in a sense, become a better human for your own objectives. I think this is the main goal. I don't want to retain people forever if that is not part of their happiness. But I do want to make sure that their journey with me made a difference in their lives. I think this is the most important thing yet. Made a positive difference in their lives.
Okay, good. The last thing that I want to say is that we talked a lot about protocols, and we, from the beginning, made clear that for you to have an onboarding process, you should have this written down. Absolutely. And you should have a system on your practice, and we can help you with that. So that's a big part of your leadership course. And if you don't have this on your practice, we can help you with that. Join us in the next edition. Go to softbites.online. You have all the information there, but big part of the course is how to implement a protocol and a system in the clinic. And we are not talking about, of course, it has that part also, but it's not technical protocols only. It's really the functioning of and that will make your company culture, and it's based on your company values, and we help you with that also. So that's the last thing that I wanted to say. Andre, do you want to add something to our conversation?
No, I think that we should welcome everybody that wants to go to our course. You should go to softbites.online and you have all the information there. Those are wonderful 3 days that we always have fun. Mm-hmm. And we are more than welcome there.
Yeah, and it's what we were talking about before. It's not only about and that's why we call it conscious leadership. It's not only about the hardcore protocols and systems. That it is about that, and that's very important. But it's that mixed with other values, mixed with empathy, like you said, mixed with human connection, mixed with keeping your individuality as a human being and being able to express that in your work. It's about building a culture, a clinic culture where you feel that you are welcomed and and that you are contributing and that you are making a difference in people's life, and you're contributing for that. So, and I think that's what makes it amazing, is that this mix that we bring.
Yeah,
and
because if you focus only on being productive, on being financially rewarding, on making sure that things run exactly always the same and within the very strict and like dictatorship style, you're not going to be happy there. And I think that we are in the point in time in dentistry that I think that everybody's starting to realize that there should be much more than personal success. Otherwise, it doesn't make it worth.
Yeah, and I think that in a dental clinic leads to what we were saying, to big staff rotation, so people don't stay there, don't stay in those places for a long time. The same way as people don't stay in a place that it's chaotic, right? That has
Absolutely.
no rules, that that everyone don't actually know what they are doing there. So I don't think that's also an environment in a dental clinic that has much staff retention. Okay, so I hope we contribute a little bit for the onboarding process to be easier, and also for this, I think that's for us making clear that onboarding is not the same as training. I think that's useful too. And if you want to learn more, if you want to know how all of this can be done in a practical way, just join us in beautiful Sagres in October.
Yes.
Go to Soft Bites online and you have all the information. Thank you very much. Thank you very much, André. And thank you for listening. We see you on the next episode. Thank you for listening to the Soft Bites podcast. We would love to hear your thoughts on this episode. Please leave a comment or connect with us on social media. Your comments and messages will help us to know you and our profession a little bit better, so that we can offer real value in return. And if you like it, please subscribe. If you want to learn how to be a leader and drive change in dentistry, take a look at our Conscious Leadership course at softbites.online.